guys. So I'm just going to throw it out that yes, I am in a different outfit, but as I spoke to you about bum explosions this morning, I spilt my lunch down me and I laddered my tights. So I'm not a diva, I just had to change. So this section is about the IBS, not just IBS campaign. We have Julie Thompson, who is a specialist gastrointestinal dietitian at Calder Hill NHS Trust and the owner of Calm Gut Clinic in Hebden Bridge. She's also the communications officer and a member of the advisory board from the IBS network.
Thank you for that introduction. So last year, the IBS network launched the It's Not Just IBS campaign to raise awareness and help change people and society's perception of IBS. The campaign, which received over 2,000 signatures, sought to educate and demonstrate that IBS should not be dismissed or treated as a trivial inconvenience. Each of those signatures represents a person with IBS, a carer or a health professional who desires change. I would like to take a moment to share some examples of the comments that we had with you. I want the stigma of IBS removed and a greater public awareness of the condition. I am also a sufferer of IBS, and it's time to break the poo taboo and get the government and healthcare professionals talking about IBS. I have IBS, but I also have amazing doctors who didn't say just. We are not properly recognised as a medical condition. I would just like my beautiful wife to be able to step out of the house with confidence, safe in the knowledge that she doesn't have to plan her destinations around available facilities or worry about getting home when the pain starts, which could last from moments to days. My body doesn't want to be sidelined by the NHS anymore. In respect to the campaign's aims, and the last comment in particular, over the last year, the IBS network have contributed towards development of the National Institute of Health and Care Excellence Quality Standards for IBS, published in February this year. These standards will seek to drive up standards of care within the NHS for people diagnosed or currently living with IBS. This represents a very significant step forward in our healthcare service, recognising the situation of many people living with IBS, and we celebrate and support this important development. We also understand that with the challenges faced by the NHS, change will take time. However, there will be huge cost-saving benefits by providing timely diagnosis and treatment. But significantly more importantly, in our view, a better understanding of IBS throughout the healthcare service will ultimately mean a better quality of life for those patients living with IBS. The IBS network offers a great opportunity for learning about IBS for both people living with IBS and the healthcare professionals. One campaign supporter commented, "I have been suffering with IBS for years, and the IBS network helped me to look at different options and alternatives to deal with my long-term illness." It has been recognised that people can lead healthier and better quality lives when patients, charities and healthcare providers work together to achieve a shared goal of improving experiences of people with long-term conditions such as IBS. As the UK charity for people with IBS, the IBS network will continue to be a source of knowledge for healthcare practitioners and hope to work with healthcare colleges to ensure healthcare practitioners are trained to provide the level of compassionate care expected from a modern patient-centred health service. We will also continue to strive to raise awareness of IBS in the future with the aim that we will all achieve a more just society for people living with IBS. Thank you.
Yeah, okay. Who's got
Thank you. Sorry, just a quick one, Julie.
Yep.
Is the campaign still open for signatures?
It is, yes. I was going to shut it, but I think, you know, with everybody being here today, there is certainly an opportunity for you all to sign the campaign. If you just log on to change.org and do a search for IBS, you'll find it.
Julie, if I can ask a question. You've got over 2,000 signatures, which is great. So a lot of people have signed up. You've got a lot of patient testimony, which is also very valuable. How do you propose now to use this? How are you going to take the campaign forward?
Well, hopefully, we're hoping to use the campaign really to get people working together, I think, is probably a first approach.
Get patients and healthcare
everybody.
professionals working together. Okay. Yeah.
I know you said you were going to close it, but if you're not going to close it for a while, sorry, thank you. If you're not going to close it for a while, do you have any literature about this that I could take to my groups for people? Because I have so many people attend my
What we have done in the
IBS.
past, we have had a link at the front of the IBS Network website
Yeah, it's
to
just
it.
that a lot of my people don't have access to.
I don't have any written information, but I
Right.
can get some for you.
Could you? If you
Yeah.
could get it to
Yeah.
me, that'd be great. Thank you.
Okay. Yeah, we've
I
got
think
one
there's
back
a
there.
question up the back.
Since I put my hand up, some people have already said it, but I think what you said, Julie, has brought it all together really nicely. And is the IBS network not an ideal platform to gather that information of what everybody's saying about what's worked for them, information where to go for help, and to try all these different things to address everybody's many different symptoms? Is your network not the ideal place to do that?
It is the ideal place to do that, and of course we do need support from everybody as well. So I would encourage people, if you can support us, join up. If you can have a self-help group, maybe set up a self-help group, we will provide you with a lot of support to do that. So yes, we can facilitate that, but it will take time and we need people's help to do it.
We got one more.
Thank you. So, just a quick question: how many signatures do we need to get on change.org for the MPs to actually talk about this issue?
It's quite a lot more than we've got at the moment. It's 100,000
Is it 100,000?
signatures. Yeah.
Wow.
Yeah.
Okay, I was thinking 10 because I mean I know we're five times less, but I'm sure we could rustle up some more. But
I mean, you know, if we need to leave this open, we can leave it open. That's not a problem at all. But we would need everybody to disseminate it as well. So please do go on there. Please do share it. Please do sign it.
Okay, yeah.
Yeah.
Okay, thank you.
Thank you.
Thanks, Julie.
Thank you, Julie.